I would like to welcome everyone to our February Trustee Forum. And again, thank you everyone for being here this evening. This is a great opportunity to see the business before the Michigan Dental Association. As you know, this is your opportunity just prior to our upcoming board meeting to have an opportunity to have a chance to look at our discussions and the business at hand that we'll be discussing next week, and also to have input, have questions answered, concerns raised, and to get an overall view of the highlights of the meeting. So with that, I would like to outline our meeting this evening with our panelists. We're very fortunate to have, well, as you know, myself, Steve Mara, President, Dr. Todd Christie, our Speaker of the House, Dr. Christine Mason, Trustee, Dr. Sherry Newman, Trustee, Dr. Bill Patrick, Trustee, and of course our own Ms. Karen Burgess, Executive Director, and Michelle Cruz holding it all together for us. So with that, I would just like to give an outline of our program this evening. Um, I'm going to go over the highlights of the February board meeting, starting with our generative discussion in the area of member engagement. I'm then going to pass the baton to Dr. Sherry Newman, who will update us on COVID-19 policies that will be discussed, followed by Dr. Christine Mason regarding vaccine administration, Dr. Bill Patrick regarding Tel Dentistry statement that's being developed or worked on rather, Dr. Todd Christie with our 2021 MDA annual session, followed by Ms. Karen Burgess, who has two items here, the Dentist Supply Company, as well as our membership update. And then, of course, we're going to save time at the end for feedback from members in your area. We, of course, would always like to hear from concerns out in our dental communities here, and then also time for questions. And so, as usual, please mute, well, you're on mute, but keep muted and use the chat function for questions. If anything's pressing, please go ahead. Otherwise, again, we'll have time reserved at the end for questions. I would like to give everyone an opportunity to be heard in any input you may have toward the meeting or any questions you may have that will be helpful, particularly to pass on to members in each of our districts. So with that being said, I would like to start things off in so far as what we'll be looking at in our generative discussion at this upcoming meeting. And for those who may not have been on the meeting before, each board meeting, we have a generative discussion looking to, as the name says, generate ideas in forward thinking, trying to make our association as ideal as it can, and dealing with problems before they arise in certainly hot topic areas. Our generative discussion this time will be revolving around member engagement, which of course, as you know, is a member organization, striving for member success. That is central to our core. And so just some background, our new strategic plan that was developed identifies member and leader engagement as a critical focus over the next several years from 2021 to 2025, which is our new strategic plan. And so we're going to be focusing on member engagement and looking at several items. We're going to start with a video that deals with customer engagement, looking at members as our customers, in tips therein, and what does member engagement mean in your association. We'll be discussing that. Encouraging member engagement through education, overcoming cognitive biases to improve young member engagement, and measuring member engagement, not just participation. And then we're going to be following up with 10 lessons learned in developing a member engagement scoring model. So obviously heavy focus on not just serving our members, but actually engaging our members, because as we all know, our legacy, really gets passed on through our newer members, our younger members, who we're looking to help develop, who will be coming into leadership positions and the like. So with that being said, I'd like to move on to Dr. Sherry Newman, who is going to update us on the topic of COVID-19 policies. Thank you.
Thanks, Steve. Thank you for having me this evening. I'm really happy to be here. As you know, the MDA advocated for dentists and their teams to receive 1A priority level, enabling us to be among the first to receive our vaccine. Unfortunately, we found about 40% of the healthcare workers have declined to receive the vaccine. Many dentists have reported that their staff are hesitant or resistant to the vaccination. Although the science is there, most of the objections that we've seen have been from myths based on myths that were fueled by social media. The MDA feels in the absence of policy, it's really difficult for dental professionals. In the absence of policy, it's difficult to advocate for dental professionals to be vaccinated. So currently, the ADA does not have a policy concerning vaccination, although we are told that the Council on Advocacy and Prevention will be addressing it. The Michigan Dental Hygiene Association and the Michigan Dental Assistants Association do not have relevant policy either, but the Hygiene Association is open to the idea and will look at what the MDA will be presenting. When we look at what our medical colleagues are doing, we find that the Michigan State Medical Society does have a policy, but the American Medical Association does not. I'm sorry, I confused that. Let's back that up. The Michigan State Medical Society does not have policy, but the American Medical Association does. So in their policy states, in the context of highly transmissible disease that possesses significant medical risk for vulnerable patients or colleagues or threatens the availability of healthcare workforce, particularly a disease that could potentially become epidemic or pandemic, including influenza, and for which there is an acceptable vaccination and immunization, absent of that, physicians should be immunized, absence of a recognized medical, religious, or philosophic reason. So the American Medical Association's policy on adult immunization encourages physicians and other health and medical workers to set positive examples by assuring that they are completely immunized. The MDA feels strongly that in order to set an appropriate example for our patients and the public, we need policy in favor of vaccination against COVID-19 for dental professionals. The executive committee approved the following as an interim policy, and it will be taken up at the full board meeting in February. The resolution 845 states that in the interest of the health and safety of the individual, the dental team, the patient, and the public at large, the MDA urges all dental professionals to be vaccinated against COVID-19 unless there is compelling medical reason not to do so. In addition, there was an interim policy approved by the executive committee that supports the MDA requesting the governor to allow for dentists to serve in the delivery model of the COVID-19 vaccine for the residents of Michigan. To this end, MDA President Dr. Steve Mira sent a letter to Governor Whitmer requesting such an action. The request is currently under review by the Michigan Department of Health and Human Services. So that's an update on what's going on with policies. I really appreciate your time. I hope you stay nice and healthy, and I hope you've had a chance to have your vaccination. And now I'd like to turn it over to Dr. Christine Mason. Thank you.
Thank you, Dr. Newman. Appreciate that. That's a good lead into my information. Okay, so this is our update on the vaccine administration. I got the data as through February 9th, so that would have been Tuesday evening. And what we will see is that this is from Michigan.gov. This shows the vaccine distributions throughout the state. And you can see, if you can see on this bar graph, the most significant distributions are, of course, in Oakland, Wayne County, higher in the Grand Rapids area. And you can see right now in the upper right, 2,023,000 plus have been distributed. That is what has been sent out. This slide shows actually those administered. And if you can see in the bottom right here, 1,391,000. So we're moving along, and probably several more have been added in the last couple of days. This shows the program enrolled providers. So when Dr. Newman was talking about places for vaccination, again, you can see in the dark blue, heavier areas down in the Metro Detroit area, Grand Rapids area, and this says that there's 2,148 providers, which dentists are not part of. This is from Michigan.gov again, and this is the local health department map. You can go to this site and select your county, and this will bring you to their health department, where it will give you the guidelines on how to set up for the vaccine. And if I go to the next page, this is what that screen looks like when you choose the counties. So I did a sample of Central Michigan, where I'm located. And then here is the Central Michigan Health page, where it's showing the phases for the individuals. And you can click through there. I didn't copy all of this, but it gives you specific information about the locations, where you fall in the schedule, and how to go ahead and set up the appointment. Here shows the timeline for the state of Michigan, and you can see that December, and this is January 2021, we have the healthcare workers, long-term care residents, Michiganders 65 and older, essential workers, high school staff, and as we progress, then essential healthcare workers 16 to 64, finally remaining essential workers, and then anyone. And you can see that on our timeline, anyone starts in August. So we have several months to go. This is the projected timeline. Currently, there are 3 actual retailers approved for providing the vaccine: Rite Aid, LeaderNet, and the Medicine Shop, and also Myers has been approved. And I spoke to my Rite Aid pharmacist, and I understand that they are in the process of trying to be approved as well. Just some overall information. In Michigan, as of February 9th, we had 625,000 plus, and new cases in the past 2 weeks was 22,000. The average was 1,522 for a week. That's new cases. And death toll 15,929 as of Tuesday. Again, the number of vaccines administered. And polling the states as far as what states are allowing dentists to provide vaccination, there are 21 currently saying yes, and I believe Minnesota is currently being approved, which would make 22 if my count was correct. So that's where we are as far as the vaccinations through Michigan. And we're looking forward to continuing to get more of our healthcare providers, including myself included. Some of my team and staff have been a little resistant, and we want to say that the MDA absolutely stands behind this. We want to advocate for everyone in our industry to go ahead and have your vaccination. So thank you very much for your time. And following me will be Dr. Bill Patrick.
Good evening. My name is Bill Patrick, and I'm going to speak to you this evening on the ADA's new policy on Tel Dentistry. We currently have a policy on our books statement from the American Dental Association dating from 2015. This new update will be dated 2020. The basic difference between the two statements are, in this particular statement, they gave a Bill of Rights to the patient. And it's effectively 8 different rights that the patients have in receiving Tel Dentistry. Uh, most of them basically make sense. The dentist must be licensed. In the first statement is the dentist must be licensed in the state where they're delivering the Tel Dentistry. Okay, the patient has the right to be part of the decision making. The patient has the right to find out who the dentist is who is doing the Tel Dentistry and have access to that dentist's licensure within that state. Those are basically the three big changes that they've made in the statement on Tel Dentistry, and we're going to be voting on that this next week, and we're going to make that our new statement. Most likely make that our new statement in regards to Tel Dentistry. And that's about all there is to report. That's kind of short. And I would like to introduce our next speaker, who is the Todd Christie. And he will speak to us tonight on the annual session coming up here in 2021. Thank you, Todd.
Great. Thank you, the Bill Patrick. I appreciate that. As well, good evening to all. Glad to have you all here this evening. I'm actually speaking regarding, as Bill said, Resolution 843 before us, which will before the board. The question will be, will the Michigan Dental Association make an announcement that the 2021 MDA annual session be held virtually? To give you some update, obviously, this has been a source of question going on for some time since last year, determining where we're at. We know we will be having a virtual house coming up in April, but this was more so how annual session will proceed. So our committee on annual session met back in January on the 13th and had an update on the likelihood of virtual rather than in person, and they've debated through this. The committee continues to be concerned that even if allowed, potential participants would not be comfortable with the in-person event. Since that meeting in January, the Michigan Department of Health and Human Services has extended their gatherings in mask order, as we all know, for what's going on through February 21st. But also this means currently that no more than 100 people may be gathered in any distinct space with occupancy limitations to 20 persons per 1,000 square feet, along with 6-foot social distancing. So these restrictions could change in February, between February and April, but it's unlikely that all the restrictions will be removed. So to that end, we've had conversations as well with the Lansing Center and the hotels regarding that. Currently, obviously, if you can believe, we're trying to book a large event. There are cancellation clause penalties and different challenges. And so that coming from our committee, the recommendation for our board to look at is to have the annual session be held virtually this year. And that's what the board will be discussing and making a decision on next Friday. So that's Resolution 843. And I will now turn it over to Ms. Karen Burgess.
Thank you very much, Dr. Christie. I have the good fortune to be able to talk to you about 2 items on our board agenda. The first one actually could have been talked to, I'm sure, by Bill Patrick as well, because it has to do with an endorsement by the Michigan Dental Association for the dentist supply company. And you may be saying, hey, don't you already endorse the dentist supply company? And the answer to that would be yes, but there's been a change. So the MDA Insurance and Financial Group is responsible, of course, for seeking and vetting endorsement relationships. And in 2018, IFG recommended and the MDA Board of Trustees approved an affiliation agreement with the Dentist Supply Company, or TDSC, which at that time was owned by the California Dental Association. Fast forward a couple of years, and as a result of the financial impact of the pandemic, TDSC has now been sold to Henry Schein. Schein does intend to run the company as a division of its own larger organization with a continuation of the TDSC brand, online ordering, and everyday low prices. The goal for the Insurance and Financial Group was to evaluate the new opportunity to affiliate with what they're now calling TDSC, powered by Henry Schein, through a GPO group purchasing organization arrangement. The GPO structure is necessary in order to remit an admin fee or royalty to the Michigan Dental Association. So if this agreement is signed, then the MDA will receive 3% of net sales in the first 2 years of the contract, 2.5% in the third and fourth year, and 2% of sales in the fifth year. At that point, a new contract would be negotiated or extended, and the expectation is that the revenue would continue at that 2% level with contract renewal. After a very thorough and careful evaluation, the IFG has recommended that the MDA Board of Trustees approve entering into such an agreement with TDSC powered by Henry Schein, subject, of course, to a mutually agreeable contract. So the goal for the Board of Trustees at this meeting will be to evaluate the information provided by IFG, have a discussion, and make a decision regarding whether to enter into this agreement or not. We've had a good relationship with TDSC up till now, so it will be an opportunity, I think, going forward, assuming that the board is comfortable with doing this. So that's the first topic. The second topic for the day has to do with the membership update, and our own membership director, Angie Kanazi, will be providing an overview of the end of the year 2020 and how things are looking for 2021 to the Board of Trustees. So I do have a few slides, so I'm going to go ahead and share them. This is not the entire presentation, but it's a little taste or a little overview of what the board will be seeing next Friday. So hopefully everybody can see this, these slides. If I could get somebody to nod so that I know you're actually seeing it. Thank you, Dr. Mason. So this gives you an overview of our membership trends going back to the turn of the millennium. So we're going to go back to when we were born in a little log cabin. Here's our end of year 2020 MBA statistics. You can see we're at 4,504 active licensed dentists for our active membership, and we have a market share of 76.7%. Every red asterisk you see on the screen represents an increase from last year. So all dentist members is up, women dentists up, GPs up, ethnically diverse up, new dentists up. And then when you look at the percentages in terms of, I have to move my screen here because I can't read my own screen. You can see that we've seen an increase in the market share for women, faculty, and ethnically diverse dentists. Now, our market share for the end of year 2020 is down a tiny bit from the end of year 2019. It had been 77.1%, but due to a little growth in the market, we've seen a little tumble, less than half a point in our market share. Excuse me while there we go. This gives you an overview since 2001 of our number of active licensed members. So you can see we had a high in about 2004, and then kind of a dip going down. And since that time, we've been on a little bit of an increase with each year. Our market share similarly was higher in the early 2000s. We saw a decrease in market share, and since then we have been on kind of a rebuilding slope. Comparing the MDA and ADA market share, you might wonder, how are we doing compared to our colleagues across the country? What you can see is that we have routinely been 10 points or more higher than the American Dental Association, and right now it's 76.7% versus 60.7% for the ADA nationally. We're running 16 points ahead. So that is a good thing, but it would be nice if a lot of the other state societies were where we are, because then nationally organized dentistry would be much stronger. You might be interested to know how our subgroups within dentistry are going, and you can see here that we have a very strong market share historically, and again this year among our new dentists compared to overall. With women dentists, there's a narrow gap, and with our ethnically diverse dentists, you will see that there is a more significant gap, but we have seen positive increases in recent years, including this year. Questions about specialists and GPs, you can see that generally speaking, specialists as a whole have a stronger membership participation rate than general practitioners do. And among the specialists, the endodontists take the cake. Steve, you can see there as a periodontist, you know, you're not setting any, it's still about 76.7%, but perio is a little lower than some of the others. Bill Pachek is an orthodontist, so we can see he can rest very confidently on his laurels associated with that. And as I said, you know, our endodontists are leading the pack, oral surgeons as well. So looking over the course of the years, you probably noticed that there has been a change in the makeup of the profession. And one of the things I just wanted to point out, and that Angie will pointing out to the board, is that we've seen on the gender standpoint in the last 20 years, a pretty significant increase in the number or percentage.
Karen, you lost your audio.
Okay, you can hear me. I was hooked up by my phone, and believe it or not, I lost my phone audio. So apologies, everybody. Just moving on, I only have a couple more slides. What I wanted to point out previously was that we have become much more diverse in terms of both gender and ethnic racial background. Moving on to look at market share by component, you can see that a lot of our components, especially the smaller components, are doing very well in terms of membership participation. And the location of our non-members, you can see this very much parallels where our members are. The highest percentage of non-members are in our larger components: Detroit, Oakland, Macomb, Washtenaw, small percentage in West Michigan, and just under 25% are in all the other components. So that is, I will stop sharing there and be happy to answer any questions. This is an informational report for the board. They're going to also be looking at how things are going this year, where we're at about 98% of where we were last year at this time. So membership retention this year is going pretty well despite the pandemic. So thank you to everyone and to Dr. Maroff for allowing me to present that info.
Thank you, Karen. We do have a question so far from Eric Rubrick, who asks, are vaccines administered the number of doses for individuals vaccinated? And Christine Mason, I think that's your question.
That's a great question. And I tried to find that out going through the website, and I did not get an answer because the number said doses administered. It did not clarify if it was a single dose or a single person with possibly 2 doses. So actually, Eric, I'm still trying to find that out. And that's a good question. I don't have an answer, but I will keep looking.
And I did see in the governor's report this week that they do sometimes report that data both ways. So they did report individuals who had received both vaccines versus overall numbers of doses. And as you may have seen the headlines today, the government bought another 200 million doses and 300 million. So 300 actually. So, and they're predicting that will, you know, help most people through July. But so I think it does get reported both ways. That's a good question. Any other questions? Such a clear discussion this evening. I really see no other questions in the queue. So with that, you know, one thing is that this is our last board meeting of this year before annual session. Actually, I don't know if we have another trustee forum prior to that one. So with that said, it's been fun. And Eric Knudsen says, great job. Thank you. So with that, we're going to sign off. It's been a pleasure being here tonight. And someone else, Dr. Mayhofer, will be taking over at our next trustee forum after annual session. So thank you, everybody, and appreciate you being here and being active in your dental association. And with that, everyone have a great evening. Thank you.